the speakers. And we are recording this meeting. So welcome to the Willamette Women Democrats. Our program's name is Measure 110 Needs Fixing. Options are on the table. And my name's Vicki Chamberlain, not Willamette Women Democrats. I'm the president of W2D. This is our fourth program for the 23-24 year in our first Zoom meeting, thanks to the weather. And as many of you already know, we are featuring Senator Kate Lieber and Representative Rob Nosse. So thanks for accommodating our last minute switch. Throughout the program, we won't be taking questions as the speakers are speaking. We'd like to save all our questions till the end. And if you have a question, would you please put it into the chat room? We will be looking at them and combining similar questions, and then we will give the representative and senator the questions when they finish their presentation. At the moment, I'd like to I'm going to recognize the elected officials, candidates, and dignitaries who registered, because I don't know exactly who's here, but we had Jean Atkins, a former Secretary of State, Olivia Clark, a candidate for Portland City Council, Nafisa Fye, Washington County Commissioner, Carl Fisher, Tualatin Valley Water District Commissioner, Jeff Goodman, candidate for State Treasurer, Mary Lou Henrich, candidate for the Oregon House, District 46, Valerie Pratt, Tualatin City Councilor, Leslie Reynolds, State Representative, Diane Rosenbaum, former State Senator and State Representative, Garrett Rosenthal, Metro Councilor, Moses Ross, candidate for Portland City Council, Mike Schmidt, Multnomah County DA, Martha Schrader, Clackamas County Commission, and Crystal Weston, Tiger Tualatin School Board. In addition, we had Annie Ellison, the Emerge Executive Director, register for the program. And Annie, I hope you're with us since I can't go through the entire list right now. If I missed anybody who is already on the call, could you quickly virtually raise your hand? Oh, that's what happens when you have a giant list. So thank you. In addition, I'd like to quickly recognize the W2D board members. Veronica Williams, the Vice President and Advocacy Chair. Rosie Stevens, the Program Committee Vice Chair. Andy Miller, the Marketing Chair. Claudia Black, Francie Manning, Karen Jacobson, our Treasurer. Leslie McBride, Secretary. Louise Curran, Vice Chair Advocacy. Nancy Murray, Program Chair. Patricia Rovinen, Mary Shortall, Ruth Spetter, and Kathy Gordon, our membership chair. So at this moment, I'd like to introduce Nancy Murray, who will introduce our speakers and give a quick background. Thank you.
Welcome, everyone. I'd first like to introduce Senator Kate Lieber. She represents District 14, Beaverton, Aloha, and Southwest Portland. Since her election in 2020, just 3 years in office, she already serves as Majority Leader in the Oregon State Senate. She is currently co-chair of the committee dealing directly with Measure 110, the Joint Interim Committee on Addiction and Community Safety Response. She chairs and co-chairs 2 other committees and serves on yet 3 others, so she is one busy legislator. Prior to her election, she served as an attorney prosecuting domestic violence and child abuse cases for the Multnomah County District Attorney's Office. Senator Lieber was nominated by Governor Kulongoski to the Oregon Psychiatric Security Review Board and served for 8 years and its chair for 5 years. Senator Lieber ran for office with the goal of re-envisioning social support and services in Oregon. From her experience as a prosecutor, as a Psychiatric Security Review board member, and board member of Transition Projects, she has seen firsthand the deep connections between poverty, mental health, criminal justice, and housing insecurity. Representative Rob Nosse represents District 42, which is inner Southeast Portland and a little slice of inner Northeast Portland. He was first elected in 2014 and serves on several committees dealing with healthcare, human services, ways and means, and notably for today's program, he serves on the Interim Joint Committee on Addiction and Community Safety Response, along with Senator Lieber. Serving on the House committees dealing with healthcare, Representative Nosse, was able to steer over $1 billion in federal and state marijuana revenues into a series of behavioral health bills and budgets during the 2021 and 22 sessions, one of the largest investments in behavioral and mental health in decades. Similar to Senator Lieber's motivation to serve in the legislature, Representative Nosse has committed his entire working life trying to make positive social change for students and working families that improves their lives. He started out as a student organizer in the 80s and 90s with the Oregon Student Association. More recently, he worked at the Oregon Nurses Association, where for almost 20 years, he advocated for working people and nurses as a union representative. We thank our speakers for sharing with us the most important thing they've learned in their legislative hearings and their public outreach. Welcome to you both.
Well, thank you for that nice introduction and for having us.
Happy to do so.
Okay, Senator Lieber, I think I'm going first, right? She's on mute. Okay, she's thumbs up. Yes, no, stop talking. Somebody else is going to talk first. Okay, I'll wait.
I think I did it. The host wasn't letting me unmute, which was a very good tactic to have Rob go first. I love that. No, I just want to say thank you so much. I appreciate being here as well. Rob and I got to co-chair a committee when I first was elected. And so this is really pretty fun for us to get back together and talk to you all about it.
We did it like this too, right?
Yeah, we did it like this too. Do you guys remember 2019 and the good old days when we had an ice storm and we just canceled stuff?
Yes.
Like, remember that? Like all the way back in 2019. But really, I think what we're here to talk to you about is a couple of things. I'll start and then I'm going to throw it over to you, Rob.
Okay.
I really, as a former prosecutor and serving on the Psychiatric Security Review Board and really serving on a homeless services nonprofit, really, I was really interested in the intersection of homelessness, housing, criminal justice, and of course, drug addiction. And when I first got elected, one of the things that we knew is that we had not invested in our behavioral health system in a way that we really needed to. And Rob and I kind of took on that mantle and started to make really targeted investments into our behavioral health system. And I think Nancy mentioned some of those. That really led to us realizing some of the I'd say, siloed sort of problems with the way our funding operates within the behavioral health system, but also made me really realize how underfunded it's been for many, many years. And really, one of the things that I knew, especially as being a child abuse prosecutor and a domestic violence prosecutor, is that all of those things are connected. I mean, we would not be in sort of the pickle we are with regard to our criminal justice system if we were able to get people services further upstream. We wouldn't have as many children at risk if we were able to make sure that the parents got access to treatment in a timely fashion. And so all of this was happening in 2021 when ballot measure 110 then was voted in by the voters and came into being in the 21 session. That was also, I just want to overlay it on everything else that was going on. We then had a global pandemic. One of the things that happened in the global pandemic is that we halved the number of people in our shelters almost overnight. So created a lot of what's happening on the streets. We continue to have one of the most expensive housing markets in the country. That too has continued to have people really be struggling and unhoused. And that's been really a difficult thing to do. And then fentanyl, which we knew about, actually took over in the period of 2 to 3 years as the major drug that we were seeing on the streets. It was as if we've had a perfect storm with regard to the last 3 years around sort of homelessness, criminal justice, and drug addiction. And so we knew that as we were putting 110 together in the 2021 session, and then again in 22, and then Rob made fixes again to it, I think in 23, right, Rob? And that was another
Yep.
big fix.
Yes.
We have been constantly looking at whether or not what was happening with ballot measure 110, understanding that this isn't just about some ballot measure, right? This is about an addiction crisis that has been coming. It's about something that we've been struggling with as a state from both mental health and substance use disorder. And so this idea that somehow 110 was either going to fix it or was also going to be the thing that made it significantly worse, I just want to level set that it's just far greater than that. And when we put together this joint committee, it was really important that we knew that we were tackling the drug crisis and not simply addressing whether ballot measure 110 was or was not working. We've been paying attention to 110 the entire time. So as a piece of that, one of the things that some of our legislators did is we went to Portugal. And we went to Portugal because we were trying to gather information from all sorts of sources. And as many of you on this call probably know, that ballot measure 110 was sort of modeled after the decriminalization efforts that took place in Portugal. And one of the reasons that I wanted to go is I wanted to see firsthand what was happening there and how it was going. So Rob also came on the trip with us, Representative Nosse, and it was really a packed trip. And I'm going to turn it over here to Rob for a minute to just talk a little bit about what we saw on that trip.
Okay.
So,
All right. I'll just launch right in. So first thing, some of us took a little bit of criticism for getting some financial help for going, but I will just say that field trips, while they're good for students, they are also good for politicians. Okay. Seeing is believing. It was very, very helpful to be able to go, especially after most of the summer and fall. There were all of these national articles in the New York Times, in the Atlantic, in the Rolling Stone, and the Christian Science Monitor, offering their observations, sometimes very pointed criticism about Portland and about ballot measure 110 and how it was going or not going. So I'm very glad that I went. We started the trip in Porto, which is the second largest city in Portugal. And so one of the great things about that part of the trip was it was arranged by the law enforcement folks that came along and joined us in Lisbon. And so I got there a little bit early and got to join them. And we met with the vice mayor of Porto. The actual mayor was not available to meet with us. All right. And the police chief. And both of these gentlemen spoke very excellent English. So none of us that went along really spoke a great amount of Portuguese. And so we were sort of able to really communicate with them deeply about how it was going or not, and how it was not going. And first, I want to say that Porto made it very clear they were very proud of what they called their social housing model, or what we might call here in the United States public housing. They're spending 12% of their city's budget on social housing, as they refer to it, compared to only 3% of that being spent on social housing in Lisbon. And they made a very big point of stressing that with us. The next thing, some of you who are sort of news junkies, maybe like the politicians that are on this call or have been paying attention to this topic, you will remember that there was an article that was in the Washington Post that said that the Porto mayor and the police were critical of Portugal's approach to decriminalization, and they thought that it needed to be scrapped or changed. And so again, part of seeing is believing is very important. The police leaders that we met with, that's not to say individual police officers or individual politicians didn't have concerns or criticism, but the police leaders and the vice mayor that we met with very much like the system that they have in Portugal. They are dealing with some challenges with it, just like any group of people that have to implement a law or a policy have to deal with, but they definitely like their approach, okay? And definitely think that it is working. Okay, so then we got, after we got done meeting with the police and the vice mayor, we were taken to what's called a drug consumption room. And that is what they call it. Maybe not the best name for it if you're going to try to make your program sound a little more PC to people that have concerns about drug consumption, okay? But it is a clear title. It is just what you would think it is. It is a place where people who are doing pretty difficult drugs can go and safely do them. The country does not purchase the drugs for them. It does not supply them. You bring them to the site and then consume them. If you're a heroin addict, either by needle or by pipe, or a crack addict, mostly by pipe, in front of trained professionals who, in case there's an overdose or a problem, are there to be able to assist you. This is a relatively new thing. The decriminalization approach that Portugal has been on the books, I think, Senator Lieber, like since 2009, right? Am I remembering that
Yeah,
correctly?
it's about 20 years old.
Okay, so keep in mind, they have had this approach to drug use in their country for 20-ish years. And they've only had this drug overdose prevention site in Porto for about a year and a half. Okay. And I think it's one of 5 in the country. And they definitely think that it is something that is working. They are proud of it. And the police stand up for it as well, because they believe what it does is it reduces the amount of public consumption and it reduces a certain criminal element, and makes it easier, frankly, for them to have people that are dealing with addiction get help and potentially treatment or transition to treatment if that's something that they want to do. And it tamps down on public use and dealing in crime in the city of Porto. So the site was supported, okay? And the police and the medical professionals that were staffing it worked well together to manage the population that was coming and various drug dealers that might linger around the place, as well as any sort of criminal element that might be hanging out near there. So that was really fascinating to see. It was a little bit, I have to admit, this kid who grew up in the country and had never seen anybody shoot himself up before. That was a little jarring, but the person was able to do it safely. And as we talked about with them, it was a way for many of these folks to begin to engage with people that were loving, not judgmental, and over time get them to consider treatment in some other form of dealing with their challenges. From then I took the train to Lisbon. I met Senator Lieber and 24 other people from around our state, and from either advocates or lawyers or people that work in government agencies that have been trying to make ballot measure 110 work, a few other politicians, and a lot of different providers, addiction treatment providers, and some law enforcement types who all came along with us to learn more about the program. So on Monday morning, we met with sort of one of the main founders. I'm going to goof up the pronunciation of his last name. I think it's Gulau. He was around in the 2000s when Portugal was being overwhelmed by black tar heroin use. He was a young physician then, and he at the time did something that does not seem radical right now in Portugal, but seemed very radical then, which was saying we should make legalized drugs, or drugs that we know what's in them, available to people so that they don't overdose, so that they have help. And because of the work that he did around this, and because frankly, also they made a really big point of saying this, Portugal was under a 40-year dictatorship till 1974. And when the country opened back up, they didn't go through the 60s the way that a lot of other places in the globe did in terms of sort of drug use. And I mean, just so by the time the late 80s and 90s rolled around, they were really awash in a way that they had frankly not prepared for or not contemplated. So in part, they said something like 1% of the population of Portugal was dealing with some addiction at a pretty profound level. And every part of society, the upper classes, the middle classes, the working classes, and people that were poor and immigrant were all struggling, knowing people that were struggling with addiction. So in part, this was also how the politics of this tipped over, and Portugal was able to tap in, to change their approach. So they spent a lot of time with us on that. Then we went and met with some providers, and we got a tour of some treatment facilities. The next day, on Tuesday, we interacted with I think the easiest way to talk about it is it's a little bit like drug court here in Oregon, but they call it a dissuasion commission. So I'll pick on Senator Lieber, since the way that the Zoom is set up, she's on top of me, okay? Senator Lieber has been busted for using drugs in public fairly regularly, okay? And has been taken by a law enforcement person to the dissuasion commission. And really what the dissuasion commission, and they're set up regionally, there's several of them in the big cities, but then they're regionally based all across the country. And there is a judge person and a lawyer, all right, but there's also a social worker. And the idea is to work with Senator Lieber and get her to agree to enter some sort of treatment program that makes sense for her. To get her to stop using in public, okay, and to begin a journey toward treatment. And so we spent a lot of time debating this, I think, because it was a fascinating thing to learn. Like, how is this working? How did you do it? Right? Because I don't think this is a part of the law that we are currently living under with regard to ballot measure 110 that is as robust as it feels like it is in Portugal. And then we had some more interaction with providers and folks that do addiction treatment work. Okay. Wednesday is a holiday, so that was All Saints Day. If you don't know, Portugal is a very Catholic country. All Saints Day is a national holiday in that country. And so Senator Lieber and I actually hooked up with one of the people that was along with us, who is a recovering addict herself, who spoke a little bit of Portuguese, and probably had a little more street smart than I did, and took us around to parts of Lisbon, and was definitely able to reveal to us where drug activity was going on, where people were dealing, where people were using, and helped us sort of meet some people on the street and get a sense of what they thought their country's approach to this challenge was and how they are handling it or not handling it. And we were also able to interact with some rank and file police officers who initially did not appreciate the fact that I took a photograph of them engaging in police work. Senator Lieber's like, why did you take that photo? But it worked out fine. We got to talk to them. Yeah. Worked out fine. So we spent that holiday sort of doing field research in the city of Lisbon, both interacting with some addicts, interacting with rank and file police officers. And then on Thursday, we had a little more interaction with politicians who were around when the law was being implemented. And I think a big takeaway for us would be that they took a lot more time to implement their version of ballot measure 110 than maybe we have taken here in Oregon. They talked about how it was over a couple of different years, a couple of different parliaments met. They had a long sort of longer implementation plan than I think, frankly, we enjoyed. But it was interesting to hear from and I think one of my takeaways from meeting with the politician was it was not that controversial. They were able to convince their colleagues to stick with it. And periodically, when there have been takeovers, the country knows left, right politics. Occasionally, politicians with more rightist politics more conservative politics have gained power. This approach to addiction has not really wavered. There's a general consensus in the country. They struggled a little bit during one of the recessions to keep the program funded the way that they wanted to. And we did hear a little bit about how they feel like they've been building back the public health component of this to the level that it should be, because they had to make cuts due to financial just lack of money to lots of programs. But we've definitely learned that. And then, we also, between meetings with folks, we spent a lot of time sort of interacting with providers, with the law enforcement, with the other politicians that came with us. The last thing that we did is we met with police leaders in Lisbon. And The police leaders in Lisbon, again, made it very clear that they are supportive of this approach. And then they talked a lot about how a lot of the prevention strategy, because they're not just relying on finding people who are engaging in drug use or drinking too much, and doing it in public and then getting them in front of dissuasion commissions. They also talked about how the police in Portugal are really responsible for the bulk of the prevention programs that are done in the schools with young people and trying to discourage too much drinking, use of these substances. And it's the police that do the bulk of the prevention programs in the schools at a pretty young age. So a couple of quick takeaways, and then I don't know if you want to do questions now or if you want to go ahead and let Senator Lieber talk about what we're sort of dealing with in the legislature. First of all, they took a longer time to implement this. It is a socialist country, and so they do a little better job than I think we do in the United States in terms of providing housing, and they have a national healthcare system, and so everybody has healthcare. And their behavioral health system feels a little more built out and a little more robust than the one that I think that we're currently enjoying here in Oregon right now. I mean, I'm sure this is not a surprise to many of you, but if you go to online and you Google like how does Oregon compare to other states in terms of behavioral health access or pick a measurement like depression or drug use, we're going to be in the bottom 40. Okay, not where you want to be. Okay, and so the Portuguese system definitely has a more robust healthcare system, they have their challenges, but their challenges with that are not as great as ours. Their law enforcement is not as mistrusted as I think ours is here in the United States for a lot of reasons that would be a totally different topic to break down here with all of you at a different time. I mean, so the law enforcement system and the public health system when it comes to addiction work very well together in Portugal. And then I think this is an important thing to sort of mention. They would still say their biggest challenge is alcohol, and dealing with problem drinking. The Portuguese, I think, are lucky. They do not have meth and fentanyl in their country the way that we are presently experiencing it here in the United States. And I think that's if we had treatment folks on here, I think all the treatment folks would say our approach to dealing with the meth and fentanyl crisis that we have is the same that we would have toward black tar heroin, crack use, other dangerous drugs. Okay, but it is more difficult, harder, takes longer. The drugs are more profoundly addictive and do more chemical damage to people's brains and bodies. This is probably an inappropriate joke, but I think a lot of the addiction people, the way that I would talk about it, I would say it is we would love to go back to black tar heroin, crack cocaine days in terms of the drug addiction to deal with on the streets rather than what we're facing with meth and fentanyl. It's just much more difficult. And the Portuguese aren't experiencing that at the moment. I think the other thing, this was not in sort of my prepared remarks, Senator Lieber, but it's an observation that I have, and I don't know how we deal with this in the United States, but like, the Portuguese don't have all the levels of government that Americans have. You have a federal parliament. You do not have state government. It doesn't really feel like they have county government. The cities have government, okay? But like part of the challenge in Portland, I think, is there's a little bit of a difference of opinion, and there has been a clash until recently with what the city of Portland wanted to be the response to the housing and homelessness and the drug issues on the street versus what the county, which in Oregon, it's really the counties that are the public health system, okay, and the behavioral health and medical system. It's not really cities that have that responsibility, all right? And there's been a clash, at least in the metro area in Portland, between the city and the county about how to deal with this at various times. That's not a thing in Portugal. Their health system is pretty much federalized. They don't have county government. The city is not responsible. Even their policing is often federal. They have city police, but they also have a federal response to policing, which I think frankly means that when the government decides something in that country, they have an easier time implementing it. They don't have to work through various levels like we have to try to make a program happen. And then the last thing I would just point out to before I think I'm done is the police in Portugal are also very grateful that they do not have American gun culture. Also a different topic for another forum, I suspect, but the police are armed in Portugal, but the citizens are not. And the police chief in Porto said he was very grateful that they don't have American gun culture to deal with. He said they're having a little bit of a stabbing and a knifing problem right now that's become a thing in Europe, but they would take that over what we have any day.
You know, I'm just going to add my key takeaways from that trip and why it was so important. You know, it really was eye-opening, and I think it was incredibly valuable. Portugal did have a much more robust system of treatment in place before they did decriminalize. They spent a couple of years making sure that that was true. I think it's really important that they don't have the fentanyl that we are dealing with here. I think was a key takeaway for me, and something that I really struck me. I think that they also have more accessibility to medication management, meaning they've got vans, that mobile clinics that go out and deliver methadone and Suboxone, and we know how to treat addiction. We just don't have enough of it. And we don't have enough treatment, but we also don't have enough medication management for people who are addicted. And there's just a different relationship with the police. You know, I mean, we have a Fourth Amendment right to unreasonable search and seizures here in this country, and they don't have that. They were a fascist country for many years, and they are able to sort of confiscate on the street much more robustly than obviously we can here. And so I thought it was a very, very interesting trip, and I really realized the sort of vast differences that we have between us and Portugal. And I think somebody commented in there that they do have a socialized system of they have socialized medicine. And we have a lot of people who obviously we cover in Oregon. We're super lucky. We cover a lot of people in our health care system, but we don't have, as you know, socialized medicine here in this country. So I think that's a big difference too. I think what Rob is really pointing out as well is that they are coordinated because they just have one governmental agency. And I think we have some coordination issues that get in our way of trying to do things quickly and robustly.
And sort of like, we can't, at the state level, there's only so much that we can do to compel a city or compel a county to do something. Though they are separate parts of government in the American system. And we have Metro too here. Okay. We also have who's paying for a lot of stuff.
I think what we also know is that we need to start looking for solutions. It is unacceptable what is happening on the streets of Portland and in many other mostly urban centers, but this is not an urban rural problem. There's an addiction problem across this entire state. People are really looking to us, our constituents are looking to us to make sure that we've got that we're going to get people off the streets and into recovery. We got to start talking about prevention more. We are never going to be able to afford the system we need if we don't start talking about prevention. We've got to reduce public disorder and things that are associated with some of the drug use. And we've got to really cut down on the graffiti. I chaired the governor's task force on community safety for the Central City Task Force. And I think perception is reality. And if we don't start cleaning up our city and start taking, again, pride in it, we're going to have some sort of perception that it is unsafe. And we've got to start doing that. Like it is incredibly important. We've got a supply problem and a demand problem, right? And you got to look at both sides of the equation. We have to figure out how to cut down on demand. The federal government is trying to figure out how to stem the flow of fentanyl. It is very, very difficult, but we've got high density districts called HIDA that are working at the federal level to stop dealers. We also know that we've got to do what we can at the state level to make sure that we stop dealing happening, especially on the street level, that we have it. We cannot have open air drug markets in the city of Portland. It is unacceptable. So what do we need to do to make sure that we stop that? The second thing is that we have to figure out how to make sure that we connect people to treatment. We have to make sure that we have the treatment available, and we have struggled with that. And that is a true statement. And we have to continue to try to build up our treatment continuum. And at the same time, to try to figure out how it's to make sure that people aren't using fentanyl in the streets of Portland and you can't walk down that street. So those are the kinds of things as we're weighing in this joint committee. We're weighing those kinds of sort of values as we go forward to try to figure out from the state level, what can we do at the state level? Yeah, Rob, Representative Nosse is absolutely correct, though. We need all forms of government to be in lockstep with us. This is not going to get solved at the state level unless we make sure that we are linking it up with what's happening at the county and at the city as well. So we are, one of the things that is, as a former prosecutor, that I was really, that I realized pretty quickly is our public health sort of system and our criminal justice system have to work better together. And that system is sort of a little bit uncoordinated in terms of, the public health system does its thing over here and the criminal justice system does its thing over here. We need to have better coordination and better linkage of those two systems because it's part and parcel of the problem, which is poverty oftentimes is driving a lot of this, and people are drug seeking and they are doing crime in order to drug seek. Well, again, it's going to be less expensive for us to prevent it. B, it's going to be less expensive for us to make sure we give treatment to people when they need it so that we don't have them going into the criminal justice system. And then if they do go into the criminal justice system, we have to realize that addiction is a disease and we have to continue to give them off-ramps like drug courts. I know somebody asked about that. Drug courts are all across the state. That when I was prosecuting cases back in the 90s, we had drug courts. That is not a new thing. We continue to have them, and each jurisdiction can decide whether they have a drug court or not. It's oftentimes driven by funding. It's oftentimes driven by that. And so, yes, drug courts can be a viable way if someone enters the enters the criminal justice system, a viable way to sort of have them have a little bit of an off ramp out of the criminal justice system. One other thing I will tell you that I'm sort of thinking about and interested in is, the war on drugs was a really awful, piece of our history. A lot of people were really impacted by that. And when people talk about the war on drugs, I think we oftentimes are not talking about the same thing. So let me define what I mean by that. We were putting people in prison for residue cases for very, very small amounts of drugs. And we were putting them in prison for a long time on felonies. That hasn't been happening in Oregon and in many other, I can only really speak to Oregon for a long time, meaning we haven't been putting people in prison for simply that for a long time. But when we did, it really cost people a lot, right? It cost them their jobs, their families, their housing. We can't go back to that. We cannot take people who have an addiction and sort of have them just be thrown away. We must be able to have a system where we actually can help them if they need it, while also creating some accountability within that system. So I think that I hope that is a good sort of overview, and I'm going to stop there because I see we're running out a little bit out of time. I want to make sure we get to some of your questions or tell us how you feel a little bit about what's going on. And I'm going to turn it back over to Veronica.
Thanks a lot. I am stepping in for Vicki. She is actually still on the call, but her system is not working very well. So I am going to handle some of the questions. Before I start, I also want to recognize that since we've been online, Senate President Rob Wagner has joined us. So welcome, Senator.
Oh, right on.
Glad to have you.
Hi, Rob.
To go to some of the questions here in just seconds as I can find them. Just need to get them showing me my questions. Hopefully that's it. All right, maybe not. Find it. Oh no, I'm not going to find the chat. Okay, give me a second. Here we go. Okay, I got it. All right, I know the question about the drug court was answered, so I'm going to skip that one. And we already spoke to the fact that the Portuguese model at this moment in time is not having to deal with fentanyl. There was, I want to go back a little bit to the drug court thing. Somebody, I think we had talked before about talking about the testimony from Lincoln County. But before you speak directly to that, would you please go back to your statement that it sounds like drug courts are optional? So is that at the county level that the drug courts exist? And so do we have counties that don't have them?
Senator Lieber, I'm hoping you can answer that because I don't know the answer to that question.
Yeah, I think Mike Schmidt's on here too. I hate to throw him under the bus, but I think so. My understanding is that drug courts are not sort of, we don't right now, it currently stands sort of mandate that there are drug courts. Counties can put them in, but oftentimes it is quite frankly lack of funding that doesn't allow them to continue. Drug courts and other kind of specialty courts. So there's mental health court, like Beaverton has a mental health court that does a really great job. And one of the things that I've been super supportive of is the Beaverton Mental Health Court. There's other specialty courts that jurisdictions can choose to put in, and drug court's just one of them.
I think part of the reason why the committee showcased Lincoln County is because they also provide treatment in jail. And most of our counties are not really doing that.
They provide that. Well, they're providing medication treatment. That's what we're talking. When we're talking about treatment, we're sort of talking about medication treatment.
Excellent thing. Just one reminder, we will not be calling on you and using raised hands. So if you have a question, please use the chat to put the question in. Thank you very much. That's an interesting question. How have dealers accepted the program in Portugal? So how does that?
I mean, they still, if you're dealing drugs in Portugal, you are committing a crime. So it's not, I mean, we didn't spend a lot of time talking about that or interacting about that part of it, but like if you're dealing drugs, that is illegal. They are, and the country is wrestling with whether or not they want to make cannabis legal or not, actually. So smoking marijuana, using marijuana products is still illegal in Portugal. And they're trying to figure out whether they want to do that or not. So I would say to be continued, but they absolutely, like, I feel like a lot of what we were watching when we were interacting with the police on All Saints Day was they were dealing with drug dealers.
Okay. So I'm just going to read.
It's decrimmed. It's not legal in Portugal. It's decriminalized.
Okay. Just a comment from Commissioner Martha Schrader that the challenge of the counties being burdened with unfunded mandates, particularly when it comes to mental health and addiction services, and in the feeling that the counties are ready to rise to the challenge, but it's only possible if they're perceived as partners with the legislature in dealing with a well-funded public health infrastructure at the county level, which we know has been a huge challenge for quite some time. So
Commissioner Schrader, I have a bill that's going to mandate that the Oregon Health Authority do a better job of evaluating what the community mental health programs need to do a good job, to be a better partner. It's a nerd bill, okay? Very small amount of money, a little bit of a study, okay? But it'll help provide I don't remember the bill number. We just got the bill number. So it's like 4,000 something. But check in with your GR guy.
Yeah. It's a good, I think, Commissioner Schrader's right in many respects. We don't, again, it's this system that is a bit, I actually, when I was, I taught at Portland Community College for like 20 years, just in the criminal justice department. I taught a course called Mental Health in the Courts. And you know, when we de-institutionalized, which was the right thing to do, we shoved all of the mental health sort of services down to the county level, but we never really figured out what we were asking the counties to do. And we never really figured out, I don't think, a sort of the robust funding pieces of this. And so I have often said we need to kind of pick apart those county contracts and try to figure out, and I think what Representative Nosse's bill is going to do is to try to give us a better understanding on what things cost in order for us to have a better understanding of what we're asking counties to do. So thank you for that question, Commissioner.
I found the bill number. I'm putting it in the chat.
Great, thank you. I'll mention that. So there've been several questions related to expanding services, prevention programs, support for youth. So can you talk a little bit about what the difference between what happens at the adult level and what happens at the adolescent level, and et cetera?
I can try, unless Senator Lieber, you feel like you want to try to answer it.
I mean, I'll follow you. Go. I'll do.
Okay,
I'll
so I'm just going to be very, it's always weird to say I'm going to be very honest or candid, like I'm lying every other time I answer a question. Okay, but to be very candid, we do a very poor job in this state of youth and adolescent mental health. And that is probably going to be, I think, the next place that we're going to have to start having some emphasis. Okay, like the main problem that I see right now is that we just don't have enough mental health providers in the youth and adolescent space who do addiction work, who do mental health work. It takes way too long to get an appointment. It's actually worse if you're on commercial insurance or employer paid insurance. It seems to me, I believe anecdotally, that people that are on the Oregon Health Plan have easier access to adolescent mental health counselors and therapists than people that have commercial insurance. So part of what, here's what's going to be coming out also sometime during the middle of session. The Oregon Health Authority, with the strong urging of our governor and people like me and Senator Lieber and a few others, is putting out a pretty detailed report of what is the status of what we have when it comes to residential treatment and SUD, substance use disorder treatment, and what it would take to actually do a better job. So like we'll have a scan of like, where do we sit currently and how much more do we need to actually get our arms around doing a better job. This is the level of care that's a little higher than outpatient, but not quite the state hospital. Okay. Just like it sounds, residential and secure residential. And I think that will be a little bit of a guidepost for us about what do we need to try to do to start to get better in the adolescent space.
Yeah, I would just say we one of the things that we've asked for, and I think what Rob's referring to is like a gaps analysis on like what's the system we want, what is the gaps analysis, so we can make intelligent like decisions around what to fund. Our adult system is still needs a lot of work. I believe our adolescent system is even so much worse off, and we've not done a good job on sort of keeping up with our adolescent system, especially given fentanyl now. You can't experiment anymore with drugs, right? That's just not a thing. It is just so much more dangerous these days than it ever was when, you know, we were younger and trying to quote unquote experiment with drugs. One of the things I'm very interested in is trying to get a strategic plan around the youth system. I think we have to follow a plan and sort of doing some work to get that strategic plan, I think is going to really inform us. But at a minimum, we have got to start engaging in prevention work, especially for our young people, even in schools. So last year we had a bill that we passed out of the legislature to take I think it was the one pill will kill curriculum that Beaver was doing, and we're asking, we're asking ODE and OHA, which is Oregon Department of Education, and the Oregon Health Authority, to put together a sort of a kit for school districts so they can deliver this same sort of fentanyl. It's mostly targeted at fentanyl, but other drugs as well, to school districts. That at a minimum, we have got to keep pushing forward on those kinds of prevention. And then as well, we need to start investing more heavily in our treatment continuum of care for our adolescents. And both of those things are going to be years long projects, not something that's going to happen in a short session or even the next biennium. I can tell you, and I do want to make this plain. I saw in there somebody had a question around the state hospital. In 21 and 22, when Representative Nosse and I made some targeted investment, and the whole legislature was completely behind this. We made targeted investments in our secure residential, and supported housing continuum, and that's the back door to the state hospital. So not only do you have to control the front door, but you got to make sure that people are moving through the state hospital, or we're never going to have right throughput. Those beds have not fully come online, but I am really, excited to share that OHA has about 1,000+ more beds that are going to come online that are hopefully going to create that back door to the state hospital, that I think we're going to see some throughput there that I think is going to really make a difference. And those were investments that we made in the 21-22 session and some in 23. But because of the workforce shortage, because it just takes a long time to get sort of especially residential treatment providers set up, especially if they're secure, that just took a long time to set up. But that's going to come online, and I think that's going to make a big difference in our state hospital.
Let me see what else I want to find in here. Sorry, I'm just scrolling through a lot of things here, and I had just gone back to that one particular question.
While you're doing that, I'll just say this. One of the things I think that we can maybe do that will be easy in the adolescent space is try to make it easier for therapists and counselors to do their job in the schools where the young people are quite often. So like, here's a little nerd thing that I think we can try to lighten up on. So, I'll pick on Senator Lieber again, because now she's on the Brady Bunch thing here. Yeah, I am. It's like just easier. I don't know the rest of these people. She's having a bad day at school. Okay. Friend of hers made a very mean social media post about her. She can't talk about a tough situation she's dealing with because her parents are not very understanding. Okay. Maybe some person she has a crush on is not returning. Okay. All the things that give adolescents anxiety. Okay. And make their sort of daily navigation of school difficult. Okay. So she's anxious. She actually feels it. She wants to go talk to the mental health therapist that is based in the school-based health center at her school. Great. Right now, when she goes in, that therapist cannot say, okay, what's going on, Kate? What do you want to talk about? Like, calm down. This is all normal stuff. They can't do that until they do a 2-hour intake and assessment, so that they are then allowed to bill for the services and support that they're providing. Okay. So all these mental health counselors that I interact with periodically here in Portland at the school, so if you could just get it so that maybe after the 3rd visit, I could do that general assessment. Like, okay, what are your pronouns? Do you smoke? Okay. Are your parents married still? All the things that probably are helpful to know about, but maybe are not the immediate concern. Okay. Like they say that would do more to make more care available in schools by not having to immediately do that 2-hour assessment, okay, before they can start billing. So I've been assured that is a state rule. That is not a thing that the federal government is making us do. And that is something I think we can investigate and try to lighten up on, and just make a little more therapy and counseling available in schools.
So there's a couple questions that are related. One was, in your opinion, what are the next steps in moving forward on the issues discussed today? And associated with that is if you would speak to some possible actions that might happen in the short session coming up.
Okay,
So-
Sarah, I'm going to punt to you and let you sort of do that since you're the chair of the committee or the co-chair.
No,
More
thanks, Rob.
speculation.
Thanks, Rob. Well, we are engaging in the process that we need to. We've actually taken the presiding officers took the unusual step of putting together a joint committee. That joint committee, a further unusual step is that we have met multiple times in that joint committee and have heard from many stakeholders, including those in treatment providers, including law enforcement. We've heard from judges. We've heard from many across sort of the continuum, people who are supportive of ballot measure 110, people who don't like ballot measure 110, people who want to talk about prevention, people want to talk about medication management. So we've heard from doctors. So we've had hours and hours. I haven't even added up, but like 12 plus hours of testimony. Plus we've also did have a public hearing, and we got over 2,000 pieces of written public testimony. We didn't get to all the people who wanted to testify, obviously, but we had over 2,000 pieces of testimony. So all of that continues to inform policy decisions. And then, of course, we set small tables and make sure that we're talking to people at those small tables about what kinds of policy decisions that we can come up with that will hopefully move the ball forward with regard to the drug crisis, and then continue to make positive steps. Those, as you know, session's going to start in February. We will have proposals that will be out hopefully before the session starts, that we're going to have frameworks out, but we won't have actual language just because that's the way sometimes it works with complicated bills like this. And I'm not going to speak directly to what's going to be in those because they're being vetted right now. What I can tell you is we've invited a lot of people to the table, including our Republican colleagues who sit in on all of these meetings, many of these meetings, to come in and discuss the good ideas that we have. I'm worried about how politicized it might get, because quite frankly, I need to solve this problem. And one thing is not going to solve it. It is a multiple parts. It is a public health response that we need to make sure that we are sort of supporting. And as we go forward, I think that those are the kinds of proposals that we need to be really conscious of. And it's not going to get solved in one short session. Like we've been working on this sort of problem now since I got there in 21, and every single year we're sort of tackling something different and in different roles. And this is just, I think, yet another continuation of that. We've been focused on the on the drug crisis, but I will tell you that mental health and substance use disorder go hand in hand. I've often said that there's a three-legged stool out there that you have to invest in. You have to invest in housing, substance use treatment, and mental health treatment, all sort of equally, or that stool falls over, my three-legged stool, because many times people have co-occurring disorders. So that means that they are both have mental health issues and sometimes are using drugs to self-medicate that. And it's extraordinarily difficult to get any kind of treatment on the street. It's difficult to live on the street, much less try to put yourself through any kind of treatment. So we've got we've got a housing package that's coming in this session. That is, again, we've had housing packages, as you know, we've continued to chase that. And we're going to, try to continue to put something together around the SUD system as well as the mental health system. I do want to say one other thing is, like, I do feel like we're chasing a tsunami, the fentanyl crisis, even though people are like, well, you knew it was coming. We knew it was coming, but it literally replaced black tar heroin as the number one thing on the street in an extraordinarily very, very short time frame. It is cheap. It is cheap. And it's cheap to buy. It's just cheap to buy. It's getting flooded in our, I've had conversations with our federal delegation, like, you've got to help us. We got to stop this at the border. We can talk about whether we should increase any penalties for dealers here. And I think that that's on the table, but it is coming. And we have got to understand that we are not the only state that is struggling with this. In fact, almost every state is struggling with this. There's higher overdoses, I think is it Arkansas? There's a state in, that have much higher overdoses than Oregon, but we don't see it because they have very, very low cost of living. So many more people are housed, right? So we have this dual problem, especially on the West Coast, all down the West Coast, where we have a very, very, very difficult drug and a very high number of homelessness. And we're seeing it on the streets, and it's very uncomfortable. And quite frankly, it's a humanitarian problem.
Thanks. A question, how are those who have, I think it's been impacted, the war on drugs, and those formerly incarcerated shaping future bills?
Well, I mean, a lot of people are very active in a couple of key organizations, advocacy organizations, that are definitely trying to lift up the voice of people of color and people like, I think the Health Justice Alliance is one of those. The ACLU is trying very hard to do that. I feel like Partnership for Safety and Justice is another organization that's very active in criminal justice and law enforcement matters, and they are trying very hard. We have a pretty, for Oregon, a large delegation of people of color who serve in the legislature, and members of that caucus, I think are wrestling with what to do about this drug and ballot measure 110 and all that stuff, and trying to help us figure out, like, frankly, what to do. And I do think one of the good things about ballot measure 110 in terms of the funding and the operations of the program is there's been a very strong emphasis on equity and on requiring the behavioral health resource networks, that are the ones that sort of send money out to community-based organizations to do assessment and treatment and housing and detox. They've been very clear that you have to have culturally specific organizations and supports in the network to be able to get funded, and that those organizations are supposed to get money. So if you Google ballot measure 110 and Oregon Health Authority, they've got a pretty good website, and you can sort of search it by county of the kinds of organizations that are getting funded. And I think you'll see a pretty good commitment to equity. I mean, we always have to do better. We always have work that we have to do in that. It's never going to be perfect, but I think we're trying really hard to make strides in that space.
And let me mention a thing about the funding in 110. The idea behind 110 was that it was going to fund the things that Medicaid doesn't.
Yes.
It's going to be like water and fill in the gaps. So the state focuses a lot on trying to fund things that sort of we can get Medicaid dollars for, because we can maximize our investment. So, when Rob was talking about the community health person who had to do in the schools, who had to do a 2-hour intake, that's because that's what Medicaid requires.
Well, maybe we do. We're going to try to fix that.
We're going to try to fix it. But it's because we're trying to get so treatment oftentimes is a Medicaid reimbursable.
Yes.
Sort of, activity, for lack of a better word. And that we've spent a lot at the state level trying to get those things up and running, even though there's not enough of them. Ballot measure 110 wasn't intended to go for those kinds of Medicaid reimbursable projects. They were intended to fill in the gaps. And what they've done a really good job in is getting peer services out into the world, is doing more culturally specific services. There's a lot of funders who got funded for recovery housing, which is something that isn't right. It's not reimbursable by any kind of Medicaid standards, but it's something that really helps get people off the street and into peer sort of run recovery housing. So I think that it's one of the things that I think that everybody thought was that all that money that was going into 110 was supposed to solve the issue. It was just filling in the gaps in a system that has been underfunded for many, many years. We need to continue to invest at the state level, as well as continue to look and make sure that the promises that the money and the funding, who's getting funded through the money of 110, that they're living up to their promises. But I will tell you that they have increased access to treatment. They have increased culturally specific access to treatment. And it was treatment that we weren't covering it because it wasn't Medicaid reimbursable. So I
Commercial
want-
insurance or, yeah.
for commercial insurance. So I just want to put that out there. I just think that it was a really important to have that as a funding mechanism for those kinds of treatment modalities. And we have to make sure that they're accountable as well. And so the OHA does have a very robust sort of in their OHA. If you go to OHA and look up ballot measure 110, you will find that they will show you all of the ways that the 110 money is being used.
Thank you. So a question that you may or may not be comfortable answering, but how is your committee dealing with increasing costs to repeal measure 110? Because
Increasing
it doesn't seem
costs?
to be the calls to.
Oh,
repeal-
calls.
Sorry.
Oh,
was-
okay. I mean, I think Senator Lieber said this like maybe an hour ago as we staged this, which is, I mean, yes, we're evaluating that measure, but like we need to, like, there's more to our addiction and treatment system and our criminal justice system in this space than just ballot measure 110. So I think, I'll find out too when all of you do, because the draft bill will come out. All right. And I think you're going to see a response, and then we'll see what the reaction is from people who think that we should just repeal the whole thing. I think, I mean, honestly, I think when you get a chance to really explain with policymakers really what they're mad about, I think mostly, and I think the public is mostly mad about when they say repeal, is they don't want to be confronted with people that are really down in their luck, living in very difficult ways, doing pretty difficult drugs. Okay. And when you say to them, like, you don't really want us to repeal the treatment, right? Because like we wouldn't have made as a legislature that over 300 million biennial investment in all of those things that are helping this system had the ballot measure not forced us to. That, I mean, that's just kind of like, to be honest with you, like that it's, I think we're going to navigate that. I would say stay tuned.
Okay, great. Thank you. A question came up talking about the work of the Attorney General and the judicial system in terms of interfacing with the changing, I'll say changing focus. That wasn't in the question, but Measure 110 came in. We've been trying to address some of these issues. How does the AG link into that? How does the judicial system link in? Are there changes going on in that arena?
Well, the AG, I mean, so local crimes that happen in the state of Oregon are taken care of usually by your local county prosecutors, right? So the AG, although has does a lot of things around like they don't prosecute at the local level criminal cases. So I think that
Yeah.
Now I know that Ellen Rosenblum has been very interested in sort of and put together a lot of things around the fentanyl crisis, meaning she's used her office to really pull people together to really talk about sort of how to solve this crisis. But that's not the AG doesn't do that. So I just want to level set on that. They're the state's attorney, so they mostly they are the attorney for the state of Oregon, and so they do a lot of advising of our.
But the local district attorneys, they have an association, they lobby the legislature, they get together and talk about policy, and they definitely have thoughts and have come before our committee and said, here's what we think you should do. Yeah.
So we've taken in there as well as the sheriffs and the police, as well as local police and beat cops, as it were. I cannot emphasize enough how unusual it has been in a short session to have this much pre-work being done and this much sort of listening to what people are saying to us in order for us to try to craft a policy that is sort of a very difficult needle to thread. But we're going to try, and we're going to put it through the public process like we do. And it's going to go through that process. And just like all legislation does, And, you know, we're hopefully going to come out at the other end with something that is workable. I think nobody is really calling for repeals. If you listen to all the sort of, whether it's from advocates all the way down to the DAs or even the sheriffs, nobody is saying we should repeal this, except for I think there's some legislators who are saying it, but
Some counties.
there's some counties. I just think that's would be going backwards in a really profound way, that it would not help us continue to move forward. I don't think I think it's more of a political stance than it is, quite frankly, a stance to try to help us solve the problem.
Well, I want to thank you both very much. This is clearly such a complex but critical issue in our state. And I do hope, we're thrilled to have everybody on the call today. This is, just a wonderful turnout. I hope you learned a lot. There's some suggestions in the chat of things that you might want to take a look at, as well as the bill number that Representative Nosse dropped in. So do kind of flip through the chat while we're talking before we end this session completely. And I just want to again thank both Senator Lieber and Representative Nosse for all that shared with us.
You're very welcome. And the committee that we're on is meeting on Tuesday.
This coming Tuesday?
Coming Tuesday.
So if you go to the state legislative site and you look for OLIS, O-L-I-S, that's their system that you can click into and watch the hearing live.
Or watch
So-
it later, right? Like everything we do gets, videoed, and and every piece of information and material that we are sent gets cataloged and kept on that. It's really a wonderful system. So yeah.
Please take a look. Okay. I have some closing comments and announcceMents that I'm putting forth on behalf of our chair. First of all, a little bit from me. As you know, Willamette Women Dems does a lot of advocacy, and we had some things planned for this month if we were meeting in person. So please come in February, because we will have them for you. We're going to have some information about the Neighborhood Leader Program and how you can help get out the vote in your neighborhoods. Also information, if you have not already done so, about how to run to be a precinct committee person and why you might want to do that. So we'll have some handouts and a little bit of information at our February meeting on both of those. I do want you to know that we will be taking some endorsement positions on critical races in all 3 of the counties plus the metro region for the May election. And so you can please pay attention. We'll keep you advised, but we do have letters out to candidates asking them if they wish to apply for endorsements. So hopefully they're checking their inboxes. And we will be working on that leading up to May. Most of the cities, with the exception of Beaverton, are going to be having mayoral and city council races in November, but Beaverton will have theirs in May. So if you're in the Beaverton City area, you're going to want to be paying attention to that. Our next program will be on February 7th. Our presenter has not been confirmed, but it's pretty spectacular. So I would suggest that you get that on your calendar. I want to double check the date, because that seems like it was not the 7th, but the 8th. But let me see if my calendar will double check it. February. Okay, I think it's actually February the 8th. Would you confirm that, Nancy? Is it Thursday? Yes, okay, February the 8th, sorry. Thursday, we start at 4:30. It will be in person right now, so that is the plan. But please watch for things in your mailbox and register for that program. Other than that, we don't have anything more. Please stay safe. We're thrilled you could be with us. We of course love seeing people in person, but sometimes when we're on Zoom, a few more people can attend that wouldn't have had a chance to otherwise. So thank you all. And again, thank you, Senator Lieber and Representative Nosse. Great work, difficult work you're doing, but we really appreciate it. So thank you all and good night.